All right, everybody. Thank you very much for joining us today. My name's Chris. I'm the Provider Directory Data Improvement Manager, and I'm joined here by my colleague Jammal, one of our product managers for the ProView for Group solution. And welcome to our midday download. So today, this is an abbreviated web series that we offer to give you a concentrated amount of information in 30 minutes or less. Unfortunately, as we're all very sad to say, in a few days we'll be closing out of our National Provider Directory Data Improvement Month. I believe we have maybe one more webinar in our series to deliver, and I really hope that you've had a chance to participate. This month, posting online, Twitter, LinkedIn, letting everybody know all the great work that you and your organizations are doing to improve the quality of provider data, specifically in your directories. So hopefully the information's been useful. We've really found the dialogue to be very enlightening. As we were brainstorming topics, we weren't sure that this webinar would garner a lot of interest. However, from the registration, it looks like the siloed data within healthcare organizations continues to be a big problem. And we're glad that you're interested in learning how you can, break down some of those silos, break down those walls. So just a couple logistics before we get started today. Today's session is being recorded. If you have any questions, please feel free to use the questions panel on the right-hand side of the GoToWebinar desktop. And all of the attendees will receive a link to view the on-demand webinar. Your phones are muted upon entry and during the webinar. I'm going to go ahead and pass it over to Jammal, who's going to give you some background on who CAQH is.
Hello, everybody. CAQH here. Thank you for coming to the meeting. Before I get into today's topic, let's talk about CAQH and the benefit of you actually attending today. So CAQH is a nonprofit organization, Alliance of Health Plans and Health Plan Trade Association. As you can see there on the slide, the members that you see there on the slide are actually our board members. CAQH, we actually reach out to a market of nearly 1,000 participating health plans, hospitals, and credentialing organizations, and we service about 1.6 million unique providers. We work with the different health plans to streamline healthcare.
Great, thanks, Jammal. So we want to learn a little bit more about you. So before we, dive too deep into the content, we're going to kind of set some, kind of baseline a little bit with some polling questions. So first, I want to know, is your organization using an enterprise provider data management platform to manage your data? So I'll give everybody just a moment to respond. Looks like many of you are, so that's great. Obviously, in this industry, there's so much data coming in and out of the system that managing it without some sort of unified platform does get very difficult. So let's ask another question. How confident are you in the freshness of the data that is flowing through that platform? All right, looks like some of you are pretty confident. It's actually kind of all over the board. Some of you are very confident that the data has been refreshed within 120 days, but then others are, kind of unsure in that, in that frequency. So maybe it's been refreshed, but not, for more than 270 or plus, over a year perhaps. All right, and then there's one more poll question I want to use today just to kind of set the all right, so our third question, how confident are you in the accuracy of the data that's flowing through the platform? So a little bit different than our previous question. All right, so I think everyone's being very truthful because I don't have any instances where someone has said that they are extremely confident that the data is near perfect. If anybody were experiencing near perfect data, then let's all just kind of rally behind that organization. All right, great. Thank you very much for participating. We really just want to kind of understand where you are in this journey and, to really help us understand how we can, position CAQH to partner with you. So I'm going to go ahead and pass it back to Jammal to go into some additional details about what we've found.
Thanks, Chris. So based on your results kind of align with what we found in the actual industry itself. It's about a 50-50 split between the health plans using PDM systems. Of course, half of them may be siloed, or you may have overall systems there. We've also encountered a situation where both cases where healthcare organizations have questioned the integrity of the data, which based on that result there, everybody's not too confident regarding their data, as we all can see there. So I think we're seeing, based on your responses and based on our market research, what we found kind of aligns with that. So let's do a little talking about why this may be occurring, how plans with PDMs can leverage existing data for other uses, and if your plan doesn't have a PDM, what can you do to deploy as a workaround to achieve some of the better outcomes? All right, so let's talk about the challenges that health plans with provider data management systems have. So as you can see here from the actual slide here, you'll see that many of our clients have great PDM platforms. However, they are not without their challenges. Here's an example illustrating of how a PDM is actually working. You have multiple data endpoints that come in. Then it's coming from your three core areas, claims data, credentialing data, and your professional and practice information. And it's built into the actual system. And then it's pushed back out to where you and your organization can actually use the data. Here's a basic overview of just what a PDM system kind of works. Majority of them do have API connections or some kind of connection that feeds into the centralized database. That information is then shared with inside of the health plan throughout the different departments, if it's claims, if it's provider credentialing, if it's enrollment, directory services. Also, you receive information from different areas, such as your fax machines, if it's prior auth information, paper applications, manual data that's entered. So there's a lot of different pieces that comes along with trying to manage this actual data. So what contributes to actual poor quality and data inaccuracy? You know, we all have heard the saying garbage in, garbage out. Well, it's kind of the same thing when you look at your PDMs. You know, it's right for the opportunity for this to happen. Let's look at a few of the contributors to that. Plans have a voice plans have voice to us that they are concerned about the freshness of the data as well. Since the different departments collect information at different times throughout the year, are not always certain that the data they're leveraging is fresh, which kind of goes back to a poll question that we had regarding the 120-day refresh. Leveraging the data, the wrong data is a actual problem, but it does happen. Departments that use different naming conventions for fields or the question used to collect the data may not have been explicit and may lead to other departments leveraging the actual incorrect data. For instance, in the case where the provider directory data improvement, often a health plan will leverage the address of the physician has included in his or her claim data and uses it as a practice location. And in some cases, this may be accurate, and in other cases, it's inaccurate. So some of the practice information be separated from the actual facility for processing reimbursements. We understand this information may have been leveraged, however, when asking specific explicit questions, or if the department that is leveraging the information has a better understanding of the information that's being collected, the team would know to avoid this data altogether. So basically what happens is you may be asking one question regarding the data and then cross-referencing it against your claims data, and you may see a difference. And what that does is leads your department to try to figure out which data is actually correct, which address in this scenario is actually correct. Drilling down even further, the provider contracting department assumes that this is the provider's directory arm, right? So based on the contract information that's in there, they believe that this is key to the actual provider directory. And some healthcare organizations may have a specific portal for providers to enter practice information for a directory, or maybe it's just a mention, right? That the department has multiple methods for collecting this information. What is missing in this process to verify or validate the information before before this is loaded into your database and stored and disseminated throughout your actual main systems. Claims and benefit department, we know that that is just a smorgasbord of contact information. You have contact, you have provider number, you have addresses that you are collecting. However, there's a chance that none of those contacts or addresses should be listed in your provider directory. So that's a huge risk. We all know that CMS is doing a lot of auditing around that. So that's a huge risk that you're running there. If there's some sort of mechanism to validate if the address is collected for this department could also be used within your provider credentialing department, this would improve your overall data quality and freshness inside of your PDMS. So again, going back to collecting the information, getting it from different departments, and what does that look like when you actually process that information internally. Okay, so here's the challenges that health plans without provider data management systems experience. So it's very silo based. The organization receives different data types, and then it comes in from your credentialing data, your claims data, as well as your professional practice information. As you can see here represented in the actual slide, you see that it's going into multiple databases. That is an issue there when you're trying to actually validate and confirm that this information is available and making sure that it is accurate. You have different departments asking providers to reattest to more than just the provider credentialing data, provider contracting data, but then it crosses over with the actual claims data. So the provider themselves are not always aware of exactly the information that they are attesting to. So there's also an increased chance of provider abrasion. We all know that providers would like to attest to things and remember to do those things, but then we run into the situation of managing the directory data itself. What we have found in our recent study is that the average provider organization is actually spending almost $1,000 a month just to manage the provider directory or directory maintenance for their organization, which is pretty large. We recently did this study in 2019. And if you have 20 plans trying to manage the directory information regarding your organization, that can become very time consuming and costly to the overall organization, as we show there. Now let's think about that for a second. When you are doing that, and put yourself in the shoes of an actual practice manager. And how do you, as your organization, contribute to this? It's not that you're requesting certain information for a reason, but based on how your system is set up, what does that mean? How does that reflect back onto the actual customer? And what kind of customer experience are you putting back to your actual provider? And where does the inaccuracies come from inside of that? So I'm going to pass it back over to Chris real quick for another one of your for a polling question, and go from there. Chris?
All right, thanks, Jammal. Yeah, so we are giving you a lot of information. We want to kind of do a pulse check here. So how many methods does your organization use for data collection? All right, now I'd be interested to see how this pans out. I've got my own assumptions. Let's see. Yeah, that's what I would have expected. So the majority, or it's actually almost a near split, are either using 2 to 3 methods for data collection, or four plus actually is the winner here. So, and that's what we find in healthcare, is that there is no single source of truth. It really takes takes a village almost. We're pulling data in from everywhere in hopes that we're always going to have the most accurate data. So you take what you can. So yeah, that's kind of what we expected to see. So that's great. Thank you for sharing that. That's going to help kind of frame some of the rest of this conversation. So I'll pass it back to Jammal to kind of continue the conversation.
Thanks, Chris. So yeah, that's pretty interesting. And majority of everyone on the call actually has 4+ different data methods of collecting data. What we've seen is kind of we've talked about how that kind of interferes with your data quality and regarding accuracy and the refreshness of it. Here at CAQH, our PDMS, or Provider Data Management, makes the verification and validation of primary source data available to actual healthcare organizations, deployed by health plans for the management of their actual data services offered. Eases the burden of the actual provider data collection, maintenance, and distribution of it, and improves the overall provider directory quality, and by enabling providers to easily review and update their self-reported professional data for the use for the health plan directories, streamlines credentialing by consolidating and standardizing primary source verification, and delivers a comprehensive multi-state information on healthcare provider licensing, disciplinary action. So here at CAQH, this is some things that we offer through our actual PDMS suite. So some of the benefits of actually having one application or one solution that supports and gathers that data for you. The provider application or data gathering process enables the providers to attest to multiple states credentialing application in one intelligent workflow. No worries about it coming from different states and different formats and things of that nature there, because then it makes it even harder for you to validate. Through our solution, we actually offer multi-state credentialing applications. Providers can upload the supporting documents directly into our system, again, which eliminates you having to try to track down and manually reviewing things. We're able to do that and take that information and improve your overall timeliness when it comes to completing the application. Also, this process protects you against delays in data processing, with more focus on prompts and real-time validation. And here's a big thing: providers can self-register with our system before health plans initiate the actual application process. In fact, it's highly likely the providers in your network or that you are looking to recruit may have completed or recently attested a profile. Again, we have 1.6 million providers that are currently using our system, with another 1.2 million coming into the system every 120 days. So we're able to come in and do the validations for those checks, so the very things that you are concerned about regarding your provider directory, and make it streamlined and make it smooth and efficient for your provider community. After surveying the information of healthcare organizations used for credentialing, sanction monitoring, and improving directory accuracy, we've standardized the frequent request data elements, and another method to ensure, which is another method for us to ensure that we're capturing the most reliable information for the providers. So as you can see, there's over 600 data elements that the industry is actually asking for. We've standardized that to be even more efficient in how we collect it, as well as validate this information. So it speeds up your time overall. Now, our nationwide adoption. So everybody knows CAQH. We've been around for over 15 plus years. We have a very large number of providers, but we just wanted to kind of give you an understanding of the impact that CAQH has made to the actual industry. As you can see, 12 different states have adopted our provider credentialing application. 25 different states have deployed the credentialing voluntarily deployed the application, as well as we support 13 unique state forms. So basically what you're seeing is that we are able to actually manage your provider community and help you manage your provider community from a credentialing standpoint and data accuracy and provider directory accuracy standpoint at a national level throughout the United States. All right, so some key benefits for health plans, for the provider, as well as the health plan credentialing and data management departments. As you can see there, it's totally 100% free to the provider, so no additional cost. We know in some markets there is a cost for certain providers. Complete single provider profile, you get everything right then and there for that provider. It's web-based workflow, so they don't have to worry about sitting at a computer, they actually can do it from their mobile phones if they can bring it up, or tablets. As we know, a lot of providers are busy or on the go. Robust security features. Also, it's electronic data and document image capture. So it saves time, so don't have to worry about anybody mailing anything to you. Also, updates can be made at any time, and we are able to communicate that information to you immediately. So that way, there you're fully aware of it, and you don't have to chase down the provider for an update. For the health plans, again, for their credentialing department, is we provide the most complete, up-to-date, self-reported provider information available. Again, it's secure, just like we said with the providers. You have access to the data in electronic format at any time of day, so you're able to get this information as soon as possible and update your directory and publish it directly to it. Also process those credentialing application or enrollment applications. The provider automatically is reminded. You don't have to do the chase. We have notifications in the system to notify them that it's time to re-credential. Also, we are continuously doing ongoing system enhancements. As one of the product managers here at CAQH, it's our responsibility to make sure that we are doing the most up-to-date and from a technology standpoint regarding the verifications and real-time system validations and things of that nature there to make sure that we're keeping everybody efficient. And also, we have a dedicated support center for you. So if you ever run into any problems or your provider community runs into problems while they're doing the application or you need help, we are here to support you as a partner in this, because that's truly what we are. We are partners in the entire workflow of the provider credentialing and data directory management. And we pass it back over to Chris. Chris is going to talk about a little bit more about our PSV process.
Great. Yeah, thanks, Jammal. Yeah, so Jammal, you did a great job kind of laying out the overarching kind of issue. I wanted to dive into a bit more detail about some of the solutions that are available, some of the services that are available from CAQH. We do have a primary source verification service. That service is here to assist healthcare organizations in ensuring the information that they have is accurate. There's a lot of these services out there. However, ours improves the speed and the integrity of the data while really placing you back in the driver's seat of the credentialing verification process. Our process, it seamlessly leverages data from the provider application. So Jammal mentioned we've got 1.6 million providers. 1 million of those are coming in on a regular basis in order to attest or certify that their data is accurate. So we leverage this tremendous provider engagement to help fulfill our primary source verification process. We systematically query 86% of primary sources in an attempt to get you the correct data the first time. We offer file completeness and data accuracy rate of nearly 100%. Now, it's not just getting you the right data, but helping you take advantage of that data in the most efficient way possible. So we characterize or categorize the data elements that really help to support plan automation. So we can actually tell you whether or not the data is valid, current, unrestricted, if there's maybe irregular results, if there's potentially very irregular results. We put that into buckets essentially and share that with you, allowing your teams to work on the most kind of vulnerable or risky files first, and really have you establish an automated process that helps you to ingest those records more quickly. So we've got a very responsive service. You've got a dedicated account manager. The outreach that can be reduced is considerable. Like I mentioned earlier, we've got very highly accurate files. The credentialing cycle is reduced substantially as well. So 95% of those initial files are returned within 14 days, and 100% of the re-credential files are 60 days before the provider's target date. Now, in addition to the primary source verification, CAQH offers sanctions monitoring. So your licensing, sanctions, credentialing, fraud, waste, abuse departments, they're really going to appreciate that we don't just limit our research to the state where the provider has or maybe will practice. We enact a nationwide search for infractions to make sure that there's no possibility, no stone left unturned with our sanctions solution. So your teams are going to definitely benefit from the continuous monitoring, the reduction in staff hours from having this kind of comprehensive solution. And again, automation, automation, automation. So we're pulling in 500 different data sources. We want to make sure that you have, the data in as quick a fashion as possible from as many reputable sources as possible. Also, on the other side of provider data, yeah, credentialing is huge. That's kind of where we cut our teeth here at CAQH. But really, to provide a full solution, we need to consider directory and kind of provider data as a whole. So CAQH has provider data quality improvement management solutions. We really are focused on reducing data administration. As Jammal mentioned earlier, the cost to the industry for kind of erroneous data administration. So much can be saved on the side of the health plans and also the providers at the practices if we were to consolidate and kind of unify behind a singular approach or streamline these processes. The amount of outreach that's necessary, CAQH takes that on. We send quarterly updates. Also, the provider friction. So, in some cases, providers can have 15 to 20 different contractual agreements with health plans, and certain regulatory requirements might ask that a health plan reach out to each of those providers on a quarterly basis. So, if you're a provider and you're getting 15 emails or 15 phone calls every quarter from all of your, registered health plans, that is a huge burden to place on the provider community. So, by reducing that provider friction, they're going to be more willing to work with the health plan community, better partners all around. So we want to make sure that everybody has as seamless a process as possible. I mentioned this briefly already, but basically the process here at CAQH for directory data quality improvement, a health plan would submit all of the providers that they're interested in on a roster, as well as all of the locations for for those providers. The providers would use the CAQH ProView application that they're already coming into for credentialing purposes. They would reconcile all of that data and basically respond to the locations that are submitted by the health plans and accept or reject that data. And we're also doing that quarterly outreach. In addition to providers just accepting and rejecting the locations that are submitted by health plans, we're emphasizing the most essential data. So we're allowing the providers to tell us how they practice at a given location. We're also asking if they're accepting new patients and determining how they are engaged with the plan. Are they participating for a particular plan or product? I mentioned this already just to show you some slides here, but this is what it looks like when a provider goes in and is asked to accept or reject a location that has been submitted by a health plan. We're also collecting, the health plan participation, the affiliation, so something like maybe I practice here 1 day per week or 1 day per month, or I only read tests here, but really designed to give you additional data that you can use in your downstream process to develop new business rules. And what it all boils down to is savings. So CAQH, the name of the game here is automation, efficiency, reducing burden on both the provider and the payer communities. And as you can see here, this kind of speaks for itself. If we were to help you improve your accuracy, a plan with a roster of 10,000 providers can save a substantial amount here annually on directory maintenance. And to bring it all home, so CAQH, we offer primary source verification, we offer sanctions monitoring, obviously the credentialing, and provider directory maintenance. So it's a comprehensive provider data solution, or set of solutions rather, a platform, if you will. So our solutions really are designed from the ground up with a commitment to our vision of streamlining the business of healthcare. We're really excited to chat more about how our solutions can help you increase efficiency and reduce administrative costs within your organizations. And I think we did a pretty good job. We went over just a minute. On behalf of Jammal and myself, I wanted to thank you for your time today. This was wonderful. I hope you got some value out of this. We do have some questions in the chat, which we don't have time to address right now, but we'll go ahead and review those and send out some responses, as well as all of the webinar materials. So thank you very much for your time, and I hope you have a great afternoon.